All right. Hi, everybody. Welcome back. That was a quick break. Hopefully, you're able to grab some water or quick snack. This day is moving by really, really fast, and it's been a great day of education. So, really do appreciate everybody joining us today. We've got two more sessions, so please stick with us. Like I said last session, I'd like to also once again, push your attention over to the right-hand side of the screen as far as downloadable resources are concerned. Also, our speakers' information, LinkedIn page, email, if you have any questions for them or for him after this session. We'll also really do encourage Q&A throughout the session, because at the end, we'll jump on and we'll go through those questions, and hopefully you've got some good ones for us, because we love questions. So please send them our way. I also would like to thank our event sponsor, Census Technologies, and once again, First Case for collaboration on the nursing credit side. Our speaker for this session is Yves Theodule. He is the manager of sterile processing at Advocate Aurora Christ Medical Center. Yves has the responsibility of managing the day-to-day operations of sterile processing in the outpatient pavilion and main hospital, as well as the GI scope processing team. Yves and his department won the Healthcare Purchasing News SPD of the Year Award for 2018. And you may remember that we had him on for the Conference of Champions back last year in the fall, which highlighted that award. So welcome back, Yves. The presentation title is called In This Together, Strategies for Leading, Coaching, and Working Alongside the Unproductive Technician. They lurk in the shadows of an SPD, spending more time scrolling through their phones than assembling trays. They clock in only to clock out when it comes to being a productive member of the team. This session is dedicated to them, an SPD's low performer who chooses to be unproductive while on the clock. Or do they? Is their low performance a personal choice, or is it the department's orientation and training processes to blame? We will dive deep into the productivity problem at hand and explore strategies to better lead a technician to success. Let's welcome Yves.
Thank you. Thank you. I'd like to take a moment to thank all of you for joining Beyond Clean and, of course, Census Technology. A little shout out to our sterile processing team at Christ Medical Center. Those guys, they're a hardworking team. We love them for all their hard work. So we can begin. I have the greatest pleasure to speak on strategies for leading, coaching, and working alongside the unproductive technician. I think it's an amazing topic, which I think most of our leaders in sterile processing can relate with having issues with unproductive technicians. So just a little bit of background about me is that I've been in the field for over 30 years. This year would be 33 years in sterile processing. And I've worked in some of the largest institutions in Chicago, and I'm very proud to be part of the Christ. What is the unproductive technician? We understand that the unproductive technician, they are actually, the team that we fight the most with. We fight with them because we want them to do their job. We want them to, come out and do the job that they're supposed to do. We try to explain to the unproductive technician how important it is to be a great worker and why it's so important that the OR need our support. Sometimes you can tell there's a disconnection. Sometimes you can see that they struggle with understanding the job that they have to do. An unproductive technician don't really care about the patient. They don't care about the department. They don't care about their team. They certainly don't care about the manager or the supervisor. So, what would cause a person to be unproductive? I just threw up, a couple of things about how we struggling with having unproductive technicians. Sterile processing, we already have a hardship with hiring employees. It's hard to find great technicians. It's hard. We're searching for technicians everywhere. I teach a sterile processing course in the Chicagoland area, and I'm still having a hard time to fill the position. So when you do fill a position, you're so grateful. But how productive would that technician be? How well would they work out? So just want to throw out a couple of things that, I experienced in my 33 years in sterile processing and also as a leader. I've had technicians that I found in the decontamination area playing on their phones instead of working. I've had, and it's not, specific to Christ Hospital, just in general, from all the places that I've worked, I've seen different things. I've had technicians, as I said, playing on their phone. They're playing video games, watching movies, listening to music videos. So if you're listening to music video, you're gonna most likely look at the video while you're working. And it's dangerous, especially in the decontam area. Somebody is gonna get hurt. Somebody's gonna get poked with, or something bad is gonna happen in the decontamination area. So we've also experienced people working in prep and pack with a phone on their workstations, watching movies. So how accurate will your trays be if you're actually watching a movie while you're building a tray on your workstation? You have people hiding, don't want to do their job. They're not. The team is fighting with them. The supervisors are stressed out, all because of unproductive technicians. One of the experiences that I've had, and I'm so glad that this conference happened, I listened to all the leaders speaking on being productive. And technicians learn how to work around certain things. Like one experience we had is a technician double scanning their trays. When you're running the report, make sure that you look at everything. Look at the whole story. Don't just run a report without looking at the details of the report. How often was that person scanning trays in the prep and pack? What else were they doing? Was these technicians, were they, actually pulling carts out of the cart wash? Look at the entire detail. Don't just jump to conclusion, because it takes both sides. Also, my favorite is the technician that's the busybody. A lot of movement and not doing anything. It looks like they're working hard. It looks like they're going above and beyond, but nothing is really happening. Well, I want to describe that low performing or unproductive technicians a little more for you, so you can understand. As leaders, because we also have leaders in this conference, as a leader, you got to keep in mind that the unproductive technicians, they're smart, they're intelligent. Those guys, they are friendly, they're very clever. I have a name that I called them. They're the eye servants. as long as someone's eyes are on them, they're moving, they're working hard, they're going above and beyond. Once the eyes come off of them, the leadership presence is not there. They go back to their phones, they'll go back to the bathroom, take an extra lunch break. They go back to doing what they usually do. And all of that is a plague to our department. It's causing harm, it's causing the rest of the team to lose the drive. The morale of the department will be affected. So, another thing I want to point out regarding the unproductive technicians, there are also pointers. You walk into the department as a leader, they're pointing at everything that's wrong because they want to take your focus off what's really going on. They don't want you to know that they were slacking off. So as a leader, when you walk into the department, don't allow them to point to anything else. Stay focused. I call that hugging the tree. Hug the tree tight. Don't allow them to let you go, take you to the branches. Those guys, they're the ones that's pointing at every squirrel in the department to take your focus off of it. As a leader, I want to remind you that people are watching. Your high performers are watching you. They're watching to see how you will address the issue. They want to know if you're going to fall for their pointing, just, you chasing the squirrel, going after the wild goose chase. They have you running all over the department, looking for things that are wrong. And meanwhile, they're going below the radar. You're not seeing what they're actually doing. As a team, as a leader, our job is to hold people accountable. Our job is to hold them accountable. Don't allow them to let you go anywhere except, to hold them accountable. So there are several factors that cause technicians to be unproductive. So here's a couple of things that I want you to look at. So it's not always, a person come to work and they don't want to do a good job. It's not always that. Some people, it's the lack of knowledge of what the job is. As leaders, our job is to train our staff to know their craft. Train them. This is your job. You have to master your job. You are an expert. Now, keep in mind, as a leader, because there's a leader side to this and also a technician side. Leaders allow the unproductive technicians to stay in the department and continue to behave that way. And the technician, their job is just to be unproductive. They want to do less as possible, right? So you have to look at the whole picture. The whole picture is some people just don't have the skills and the knowledge. What are you doing to get their skills up? What are you doing to get their knowledge up? And as I said, as a leader, I'm never going to ask someone to do something that I wouldn't do myself. Do you really understand sterile processing? What type of training have you received? Do you know why? Have you been in the OR? Have you spent some time watching a surgical case? So all of those things are important. Matter of fact, I love to do this because it helps your technician to understand their job really, really well. Sometimes, have your technician build their own trays. Have them do their trays. Have them pull the case card. After they're done building the trays is sterilized, it's on a case card. Take that technician to the room, introduce the technician to the surgeon, let the surgeon know this person has done your trays. Feel free to share some of your experience with them. Technicians need to understand how critical that job is. And we need to paint that picture clearly for them. If we don't paint the picture, you will continue to have the same type of behavior. If the technician is a great tech, and by the way, you would never throw your technician in the OR to get, devoured. That's not the intention. The intention is to get the skill for them to understand how critical your job is. I hear leaders all the time. Leaders who understand sterile processing. They speak on the amount of they tell you that give me quality over quantity. Well, I just heard a leader in a previous that says both is important. Totally, I agree with that. Both, you need quality and quantity because they both go hand in hand. So could you imagine if the fire chief told the ambulance driver they only wanted quality and not quantity? Or just get the patient to the hospital safely as possible. Not fast as possible? This is a level 1 trauma center? Ladies and gentlemen, we need to explain to our technician how critical it is to have both. It is so critical because you would never tell the ambulance driver, take your time and get the trauma patient to the hospital. No, they're going to drive as fast as possible and as safe as possible. And this is what we need to teach our technicians, especially the ones in level 1 trauma center. So to continue, build their knowledge, build their skills. When the technician is working on the sterilizer, do they understand what a pulse is? Do they understand the jacket on the sterilizer? Do they know the different parts of the sterilizer? What's the purpose of the drain? What's the difference between pre-vac and gravity? Do they truly understand those things? Because the time of 1980s and 90s where we were taught sterile processing through word of mouth, those days are over. We need to become subject matter experts. And when your technicians become expert, you get more quality. So the second note is that the technicians don't understand the expectations. Do you have clear expectations? When you're explaining to the technicians that they have to do 25 trays in an 8-hour shift, how clear is that? Why would you get upset if they give you 25 trays with 2 items in them? I mean, you're not giving clear expectations. So clear expectations say you handle 25 trays, but you also have to handle 1120 instruments. So if you hit the 25 and you did not hit the 1120, then you still have a problem. Clear expectations is important. Don't just drop a technician in the decontam and they're wondering what to do next or how many trays should I do. Low performing employees will look to their partner to count how many trays they've done so they can do one or two under them. It is your duty to give clear expectation to your team. If you don't, you are failing them. And then do your technician, the unproductive technician, have some type of outside issue, any personal issue, because you don't want to beat up on anyone that's going through something. One young lady that worked for me in the previous hospital, she had a hard time. She used to be a high performer. Then I'm looking at her production; it changed significantly. It's important to have a sit down and discuss what's going on. Explain to me, what can I do to help you get to where you need to? Well, she explained that she was going through a hard divorce. As a leader, we need to care about our team. You do not beat on someone that's going through a tough issue. Now, keep in mind, I know that the unproductive technician will bring a lot of issues. They have problems all the time. They will always bring you problems. This is, part of their character. But some people, they're just going through a hard time. Allow them the time to heal. Allow them the time to feel better. Give them a little bit of time for with you one-on-one to listen. Leaders that's on the line right now, do you practice 80-20? Do you listen 80% of the time and speak 20? Or do you do more speaking than listening? Listen with your heart. People will work harder for you when you listen with your heart. When your technicians know that you care, they work hard for their leaders. A lot of times you will find unproductive technicians because they hate their leaders. They hate the people that they work for. What are you doing? What are you doing about it? I don't want my employees, my leaders to look at me and say, "Oh God, I hate working for this guy." Well, get exactly what you asked for. You're creating low performers. Some of our leaders, they create low performers by not caring, by not listening. Then you have, of course, your long-term team members, the ones that's been in the department 10, 20, 30 years, 40 years. Sometimes they get tired. They get bored of the job. What are we doing to re-spark the energy in the department? All of those things, all of the stuff that we won, Sterile Processing of the Year. We've been published in several of the newspapers. DNV, we're the first in the state of Illinois to win the DNV certification. I mean, all of those things, and it goes on and on and on. If I turn the camera around so you can see all the achievement that we receive for our department, you will understand those things are used to spark up something new in your staff. Bring the life back in the department. When you walk in your area, I mean, are your technicians happy to see you, or do they say, "Oh God, here they come again"? Don't create that type of environment. It's a horrible environment. Bring the spark back. Matter of fact, for our long-term employees, we've adopted something a long time ago. When a technician is retiring, the entire department stops. On that last day of them walking out of the department, we're lined up on both sides of the hallway and watching them walk out for the last time, and we're clapping, clapping, and showing respect. We do not beat on people who has given their life to our department. We want to recognize them. We want to build them up. We want to show them some love. They have given all of their youth, all of their energy to our hospital. And because they're a little slower than the younger technicians, we're going to beat them up? Absolutely not. We're going to show them some respect. And then you have some people that just have a health issue. How would you like if we beat you up to do more work while you're having health issues? You know, you want people to treat you the right way. You treat others the way you want to be treated. So we look at, as leaders, we look at those things and we watch out for them. We build people up. We're in the business of building people up. My leaders that work here at Christ, they're not allowed to just write people up, terminate people because they're low performers. Anyone can do that. It's easy to fire someone in sterile processing. We live in a glass house. Very, very clear. It's very easy. I'm not impressed with that. I used to be impressed with that. I'm not impressed with that. If you want to impress me as a leader, I want you to change that person's view. Change who they are. Build those people up in a way where they can be productive. They can enjoy to come to work and perform. That is our job. That is what we're called to do. I'm not just a manager. I came up the rank as a tech. So I know what it's like to be a technician. I know what it's like to have, the low performing technician working side by side with me. So team, remember this, okay? You need the whole picture. You need to look at the entire picture. You need to be able to see whether or not this person is just, if it's a health issue, again, say give them time. Allow them time to heal. It's okay. I promise you that those guys will never forget it. They will remember that when they were sick, you were there for them. You didn't forget about them. And when they become healthy, they will perform even harder for you. And then we have the last one on the list is the lazy one. They're just downright lazy. What do you do with that? After you have done everything you could, you have gone above and beyond. I believe in giving people opportunities to improve. You want an opportunity to improve. You weren't always, who you are. Why not give people an opportunity to improve? So as a leader, our job is to help those guys. When you've gone above and beyond, now it's time to look at the corrective action. Keep in mind, it's called corrective action for a reason. It's there to correct the action. Prior to you issuing a physical corrective action, you need to be working on that person, not just throwing papers in their faces and making people feel bad and terminating folks and sending them home to go be with their family. And sometimes we destroy families like that, and it's not just the technician's fault. It could be your fault too because you didn't pay attention to what's going on. Lazy people, again, after you've done all you can, lazy people, people who don't care about our patients, they need to go. One bad apple will spoil a bunch. Again, you've seen it. Who wants to work with a lazy person? They're working in decontam and going to the bathroom every 10 minutes. They're pulling case cards. You pull 10, they still on their first one, dragging around, texting on their phone. You hold those lazy people, those low performers, the unproductive technician that you're for sure, you know what the issue is. You hold those people accountable. They destroy the morale of the department. And your job is to protect the morale. Your job is to stand up for your high-performing technician. And here's something else that's disturbing. Leaders, sometimes we will bypass the low performer to go to the high performer and add more work to the shoulders of the high performer because they will never say no to you. You're afraid to go to the low performer because they come up with all the excuses. They're going to fight you all the way. Our job is to make sure that they get addressed. You don't have to expose them in the middle of the floor or in huddle. You don't have to do that. However, there is another important thing, another key thing that we as leaders must do. How about recognizing the people that works hard for you? How about putting those guys on the spotlight? Why not bring recognition in front of everyone? You shouldn't feel bad about it because your low performer that is highly gifted with words may challenge you. You shouldn't be afraid of that. You need to recognize the high performers. What we try to do, we do the kudos. Send the employee kudos. That's great. But are you reading the kudos in front of the team? When you read the kudos in front of the team, it's building other people around them. They're looking to say, I want to do kudos too. I want a kudos, so I'm going to work hard just like this high performer did. So you're setting a standard for people to reach. Don't lower your standard where everybody can reach it. Set a standard. So bring the recognition to the team. Do it openly. Set new standards. How about you apply for Sterile Processing of the Year? Let the team know. It's going to bring engagement. Do team building exercises. Guys, we have something that we give here called the Savvy Award. Every year during Sterile Processing of the Year, we stop, and it's a big deal at the hospital. My boss, who is Katie Sabor, she's she's an amazing boss. She brings in the president of the hospital, the vice president. I mean, the list of people that come to this award that we've created to recognize high-performing technicians. We give this award to one technician per year, and the plaque is very expensive plaque, and we partnered with some of our instrument manufacturers to give this plaque with us, and they're receiving. Some of the technicians have received 60, 70-inch television. So we've been given those. Those are all things that you can do to build the team up. Folks are looking, they're listening. The department should be a high productive department. The lazy people will feel uncomfortable. It's okay. It's okay. It is okay. Part of the unproductive technician is selecting the right team member. And when you selecting the right team member, how well do you know how to interview? How well do you interview? I am so concerned when I hear team members or leaders doing the typical interview sheet that they have in front of them. Yes, we have to keep the same standards. We have to ask the same questions. I understand that. However, these are some of the most simplest questions that you can ever find. There's a Bible verse that says that whatever the mouth speaks, it's what's in the heart. So if you know that the mouth is speaking what's in the heart, this is your time to draw close, to listen during the interview. As I said, you need to ask key questions. Don't just ask the basic questions. Everyone is prepared for that. What are your strengths and your area of opportunities? Everyone is ready for that. They've been studying it. The same list that you printed off the internet, they also have it. So how about if you're creative with the questions that you're asking? How about a question like this? I know it's going to sound, unfair, but you can ask the technician, what would you do if you were working in sterile processing all by yourself and you receive a call from the OR from room 1 and room 2 asking for the same tray? You only had one tray to give. Both rooms are asking for it. And they're both trauma trays, both trauma rooms. So it's a difficult question, but team, understand, you're not looking for an answer. You want to see how that person think critically. Your job is to listen to see what type of answer are they going to give you, if they can think on their toes, or if they're going to give you a lazy answer. Those are things that you need to watch out for at the door. You do not want to allow a low-performing team member to step into your department and destroy it. So it's really, really critical that you go through that interview process. So when we go through an interview process, whether we're hiring a technician or a leader, we ask some challenging questions that's going to have that person dig deep to give us answers. And if you just listen, don't do more talking in their interview. Listen more. Listen with your, not just with your ears, but listen with your heart. And you will find the right people. Stop hiring the same type of technicians. We keep repeating the same mistakes. Obviously, it may not work. That way may not work. So leaders, take your time to find creative questions And then I want to go to this next point is leaders must be involved through the orientation process, the training process. How involved are you? The first 90 days, it is critical time. First 90 days is very, very critical time. The best way I can explain this, when you meet a new person, a new technician, a new leader, whatever it is that you're hiring, they should be at their best behavior. They should be giving you 100+% at the door. You should see them trying hard. If they're coming at the door, if they're in the doorway showing their behind off, acting up, being lazy, hiding, don't want to learn, it's time to have that sit down. It's time. Matter of fact, what we do here, day one, I'm having a one-on-one with the technician in my office, laying down the rules. These are my expectations. You need to lay down the rules in the beginning. So, how are the folks being trained? Are you also monitoring? If you would you be impressed with? Every technician has to go through a test in the department with the educator, but also with me as a manager. I make time for that. I'm gonna ask you a question that I want you to explain. And I'm not looking for answers. I want you to explain reason why. You run a biological on the sterilizer, explain why. And while you building the technician skills, they're understanding their job way more. And guess what happened? You're creating someone that is very, very strong. Okay, I think I'm almost out of time. I think I may be out of time. So I'm gonna slow down a little bit to pass it over to Brett before I.
No, Eve, that was amazing. I can't tell you how many good pieces of insight you had in that whole presentation. So thank you so much. I think one of the ones that I pulled out of there as a good money quote is train your staff to know their craft. And I think that one is, that's bulletin board material. I think that was really good. And I was on the vendor side, but when I was in I've been in a lot of sterile processing departments, and in terms of leadership, there were a number of times when I was in departments when I would see technicians that weren't being very productive, that were frustrated, that did not have the acumen to even change out some of the chemical containers. And a lot of it was the leader, the managers and this wasn't all of them, obviously, but a couple of them in particular, and I'm not going to name anybody, but it was very obvious that it was leadership that was really toning down the morale and the desire to actually do things. And so, as you said, leaders really do need to be a good leader is one that motivates, and that one that celebrates, and that gives back to their technicians and gives them the ability to succeed and grow and care about their job. And so I really do appreciate all of that insight. And we do have a couple of questions. We have some time for some audience questions, so I'm going to throw some out your way. This one comes from Michelle Wiley, and she's asking, what are 2 attributes that you look for in a potential CSP tech prior to hiring them?
Oh, Michelle, that's Michelle from University of Chicago. She's a good friend of mine. One of the things that I look for, top, have to have it, is you have to have a sense of urgency. I gotta see it. You have to have. I mean, I have several, but a person have to have integrity. You cannot work in sterile processing without integrity. Go somewhere else with that. Absolutely not. And it's a big list. You have to be respectful. You have to treat people right. If they don't, they won't care about the patient. So, yep, I look for people with integrity to work here.
That's a good point. So on the flip side of that, I know you brought some of these up, but what are some red flags that you see, say in the interview process, and to try and just stop it before it begins? That maybe they've got the acumen to really learn something, but there's a personality trait, or there's something that just doesn't jive with what you think. Do you have, how about maybe one or two red flags that you see?
One of the red flags, I mean, it always starts with the resume. I mean, let's examine the resume, guys. If the resume show you that the person is, you have very short period of time in the job, why, what makes you think you can change that person? They had many years, working, 1 year here, 2 year there, 1 year, 6 months. Run. Don't waste your time. It's too costly to go take a technician through the orientation process, and you're taking a educator or a preceptor time to build this new technician, and you know that they're going to leave you in 6 months. Stop wasting your time. So another red flag is that if you're listening closely and you're listening to, we ask questions like, if the elevator was broken and you had to take a case cart for a trauma case to the third floor, how would you get it there? You want to listen to see if that person is going to give you an answer. We know nobody's going to take it, up several flights, but let's listen to what they're going to say to see. There are key things that they're going to tell you that's going to be a red flag that said that person is lazy. And if they're telling you that at the door, all you have to do is believe them. That's it.
Right. Well, and I think, you talk about the resume too. I think it's also how the resume is presented, right? I think taking the time to craft a well presentable and good looking resume says a lot about who you are. Attention to detail and just the appreciation of what you've done in your past, and not just something you're just throwing on a piece of paper. I think that also says a lot to somebody. Here's one. This is a good one. This is from Rickinson. How do you address unwanted noise? A good example would be loud music that disturbs some coworkers that avoid to address due to fear of conflict or retaliation.
Unwanted noise. If you cannot approach it, so unwanted noise meaning maybe music in the department. So you have different types of technicians. Some technicians can't focus in a noisy area, right? So if in a case that you have someone who just can't focus with loud music, you have to ask that person to turn that music down. Now, it's okay to have music in sterile processing. Music motivate people, right?
Yeah, you hear it in the OR too.
Yeah, of course.
Yep.
If it's way too loud and you cannot approach, allow your leader to approach them.
Right. And And then there's the gray area of I don't like the music, but everybody's got different music tastes, right? So, I sometimes I have a co-working space I go into, and if you're not first in there to select the music, then it's whoever selects it, and you may not like it, but I think it's part of being a team player, and just knowing that everybody has different tastes. Um, Another good one from Michelle is, why do you think leaders allow the unproductive tech to exist or to keep to keep working?
Very simple. It's hard to hire technicians. So sometimes they think, at least I have a body there. That body will destroy your department. I'd rather nobody than somebody that's going to destroy my department. You, at least, your team will work hard for you if they will pick up the slack than allowing just a person to hold a position where they don't need to be there.
Right.
Once you know for sure that person is a slacker, you need to work on that. You need to work on getting that person um, moving up or out.
Right. Yeah, the old fashioned sit down, right? And what's working for you, what isn't, what can I do to help you, what can I do to support you? And give them the tools like you've said, but if they're not going to use those tools, then time to everybody, not everybody's meant for this job, and sometimes it's just the right way to go is to go somewhere different, and then it's our job as leaders to help them find that path. um, a good one
And I
from
think,
Go ahead.
go ahead, go ahead.
Oh, I had another question, so I'd let you finish that thought first.
And I was going to say, it's also okay to have that hard conversation. When you having that hard conversation with that technician, it's okay to say, "This is what I've seen. This
Yep.
is my experience." You can't, the numbers doesn't lie. It's gonna show you exactly what they're doing, and it's okay to let them know. Someone that you terminated that you terminate should never be surprised. It should never be surprised unless they surprise you with something really, really foolish, right?
Right.
But
Yep.
they shouldn't be surprised. They should know what's coming because you've given them plenty of opportunities to change.
Right. No, that's a really good point. Yep. Part of being a leader is trying to help them grow, and if they're not going to grow, then they should know. I guess that rhymes. um, Sheila had a good question because you had mentioned working with the surgeons, introducing the techs to the OR, showing them. I think that's an invaluable piece to this, because when it all comes down to it, it's the patient at the other end, and giving them the understanding that their job is critical, like you said. So, in your experience, and this probably varies by, facility, are surgeons and their team generally open to meeting SPD staff?
So far, I have not found one that's not. Matter of fact, they're very open to share because they know the more education that the technician receives, the easier their lives are. We're working for the surgeon, so they understand why we do what we do. Our chief of surgery, Dr. Bayless, very very involved with our sterile processing department. He's very, very involved, and we've allowed technicians, of course, the OR and the nurses, techs and nurses. They, of course, they come through sterile process and they learn, but we also go in the OR and share some of the experience. It will be helpful It is so rewarding to watch your surgical instruments being used. You walk away a changed person to know that your instruments are being used. Where you find trouble is when the technician make no connections with the stainless steel instruments they are handling in a patient. That's
Right.
dangerous.
Yep. Yeah, because when it comes down to it, this is it's about patient safety. It's about somebody's loved one on the other end. And, I think making sure that they come through surgery safely and they're there with a smile on their face at the end, because as we know, the recovery piece is hard enough, and to do any harm with any kind of infection to add to the burden of, or add to the challenge that's part of the recovery process, is just, we don't want that, and that's not what we're here for. Yeah, and a good example, when I was in my hospitals, is that the nurse teams at a lot of the hospitals I was part of would involve SPD staff in their daily huddles. Um, it was a team effort, and oftentimes when I was training on pre-treatment practices, it was everybody. It was SPD, it was OR, it was even the surgical techs, infection prevention. So it's, everybody in the process, it really is, involved. And I think, of course, involving the surgeons is very important, because when you look at, I've seen surgeons go into departments with their eyes wide open, not knowing what actually goes on. So I think that's really important. Um, I've got another good one here from Heather. Change is hard for everybody. So how do we address a long-term employee who just does not want to continue to learn and progress and change with the needs of the position?
That's a very good one. That's a very good one because long-term employees, they've been there, they've seen, the ups and downs. Those guys, matter of fact, those guys have seen multiple managers through that department. So to get them to buy into your training, what's the purpose, right? I'm getting ready to I'm planning on retiring. I'm planning on leaving. So how do you get them to buy in? The same way you get the new technicians to buy in, reminding them of why they're there. Sometimes it's just we've been there so long, the picture in our head has, gone blurry. Revive that. Take them into the operating room. Matter of fact, um, and again, keep in mind those senior people. We're not trying to beat those guys up. Those guys have given the hospital a whole lot. They've given all their youth to the hospital. Let's not beat them up. If you can find a lighter job because of their aging, because of how they're aging, it's okay to find a lighter job. So you can find ways to encourage them. It's going to be very tricky because of their experience, but I think just the same way you do for the newer technician, it will work for them too. I have a technician that I have in mind who's been working here for 30 plus years, and she runs circles sometimes around my young ones. And why does she run circles? She says she enjoy her job. She understands it. She can remember how this place used to be and how it is now. We need to make the job easy for our technicians to do. Sometimes the job that we create is so complicated, people don't want to do it. I wouldn't want to do it. It feels super complicated. You have 100 steps to sterilize an instrument. As a leader, your job is to simplify that, help them understand it. simplify it. There are ways to make it simple.
Right. Well, I think that is a perfect way for us to end this session. We're just about at time. And Eve, I just want to say thank you for taking the time and for all of your great insight, your leadership, your passion for the industry. We love what you do, and we really appreciate what you do. You shine a big light on sterile processing, and so thank you so much.
Thank
Everybody out there, thanks again for joining us. We have one more session, and it's a panel discussion, so it's going to be some good questions, some good topics and things that come through that. So please stick with us. One more to go, and then you're off for your CEs. So Eve, thanks again, my friend. We'll be talking soon. You have a nice weekend, and thanks again.
Thank you. Have a great day.
All right. See ya.